Welcome to the fascinating world of body-focused repetitive behaviors, or BFRBs for short. These are behaviors like nail biting, cheek chewing, lip biting, and finger cracking that often pop up as tiny stress relievers or ways to regulate emotions. Sometimes they blossom into more serious concerns like trichotillomania, yes, pulling out hair, teeth grinding known as bruxism. Ever heard of ankylosing? That's where nails start to separate from the nail bed, often linked with nail disorders like ankylosing mania. A mouthful, but a common BFRB too. Now, what's behind all this? Well, genetics play a role. Think about single nucleotide polymorphisms and genetic variations that influence our behavior. Some folks have a higher tendency to behavioral inhibition, meaning they're more likely to shy away from new or unfamiliar situations, which can lead to fear or avoidance. This can turn into a cycle of negative reactions to novelty, boredom, or stress, fueling those repetitive habits. But fear not, there are a lot of ways to tackle these behaviors. Cognitive behavioral therapy, or CBT, is a star player, helping us understand and challenge obsessive compulsive tendencies and spectrum disorders. For more specialized care, dialectical behavioral therapy and acceptance and commitment therapy can help us accept our feelings and commit to healthier habits. Comprehensive behavior therapy combines these elements, focusing on psychoeducation, replacing harmful habits with positive ones, and even practicing muscle relaxation or diaphragmatic belly breathing for calming down. Habit reversal training is a favorite technique. It's like training your brain to recognize these urges and respond differently. Awareness training helps you become conscious of when you're engaging in these behaviors. And competing response training teaches you to do something incompatible, like clenching your fist instead of biting your nails. Sometimes these behaviors serve as a tiny stress relief, but they can spiral into stereotypic movement disorders or body dysmorphic disorders. Stress, boredom, and the pursuit of gratification or pleasure all play their part in this complex puzzle, which we call etiopathogenesis, the origins and developments of these behaviors. To break the cycle, behavioral activation gets you moving literally. Encouraging engagement in enjoyable activities can reduce the need for these repetitive behaviors. Thought challenging and self-compassion helps us reframe negative thoughts and treat ourselves kindly during setbacks. And for those moments of intense urge, techniques like mindfulness, therapeutic integration, and decoupling and sensory breaking the link between stimulus and response are incredibly helpful. Sometimes understanding the vicious flower maintain its formulation, basically, how these behaviors sustain themselves. However, behavioral intervention aren't just about stopping unwanted habits, they're about replacing them with healthier, more functional behaviors. So, at the end of the day, everyone deserves a tiny stress relief that doesn't come at the expense of our well-being.